Mr. President, I wanted to take just a few minutes this evening to talk about the Affordable Care Act and some of the impacts that we're seeing in my state of Alaska. We refer to this as the ACA, the Affordable Care Act, but most of the folks, when I'm talking to them back home, call it the Unaffordable Care Act, because we're just not seeing how this is making medical care, health care, insurance, any kind of care more affordable. Last year nationally, we saw a dozen co-ops fail that were created by the ACA, which literally threw people into turmoil, leaving them questioning if they had insurance at all. United Health, one of the largest providers in the country, has been forced off the exchanges in numerous states. Just last week, we had the news back home that Moda Health was going to be withdrawing from the Alaska market in 2017. What that means, Mr. President, is that we will be a state with only one option in the individual market next year. So what that means for the some 14,000 Alaskans that are currently on a Moda plan, they're going to be forced to change insurers next year. But I guess it's an easy choice when you only have your choice of one on the individual market there. And then, of course, just last week, we saw a court find that the administration's payments of the cost share reduction was unconstitutional, so we can only assume that that's going to further exacerbate problems. This week, in the Wall Street Journal, there was an article about the ever-shrinking market for rural areas. And the article mentions a small business owner in Kodiak, Alaska, a bookkeeper, who is worrying about what the price of premiums will be when you're left with only one option. And she makes this statement. She says, it's going to be a monopoly, basically. Here's the price. Take it or leave it. That's what happens when you have just one. As the market continues to fail in other states, we are seeing other states lose their options as well. Alabama and Wyoming are also now left with only one choice, and more states may be facing this in the near future. The Wall Street Journal article goes on to point out that the patchwork of coverage reflects continued instability in the individual markets as companies shift their geographic footprints to avoid areas that have turned out to generate steep losses and focus on places that they believe that they can get their ACA business into the black. So what that means for states like Alaska that are very rural and that have some of the highest health care costs in the nation, we're just not attractive enough to foster competition. And at the end of the day, who suffers? It's the Alaskans. It's those who are seeking the care. The administration says that the market just needs to, quote, stabilize and evolve. But really, what about this bookkeeper in Kodiak? What about educators out there, parents who are left wondering, what do we do in the meantime? It used to be that the federal government broke up monopolies and worked to foster competition in order to benefit consumers. But now what we're seeing, at least playing out in my state, is through bad law and failed policies, we see that same government creating de facto monopolies in the individual marketplace. I find it deeply troubling that as these options, these health insurance options continue to shrink, any hope of curbing the rapid increase of premium rates also disappears. We are constantly asked by our constituents, are my premiums going to continue to increase? We're talking about monthly premiums in the state of Alaska amounting to $3,000 a month for a family. Think about that. That's not affordable in anybody's book, and it's not beyond the realm of possibility given what we have already seen. Last year, in Alaska, between Moda and Primera, the two that are covering on the individual markets, the increases were over 30%, somewhere between 32, 35% increases over the previous year. Now, I've been on the floor here. I've shared stories of hardworking Alaskans who are paying a couple $1,000s a month for the cheapest bronze plan that is available on the exchange. I've spoken about how the ACA has been called the single greatest threat to quality public education. And the reason for that is our school districts were being faced with hundreds of thousands of dollars in fines under the Cadillac Tax when it is imposed. I have relayed stories from employers who are saying, I can't afford to expand my business. I won't expand my business because of the employer mandate, harming not only the businesses but the workers themselves. So bottom line, and I hear it from all corners of the state, the ACA is not working for us in Alaska. I had a group of realtors from around the state visit me in my office here last week, and one woman in the group said that she was paying $2,500 a month. She's got a family of 4. She has a $6,000 deductible for her coverage, and she's saying, you know, this is really hard for us to keep making these payments every month. They don't qualify for the subsidies. I talked to another young family from Eagle River who was forced to switch from Primera to MOTA after the ACA passed because the premium increases were not sustainable. And even then when they switched, they were paying $1,200 a month with a $10,000 deductible. So what happens when you got a deductible like that? You put off that health care. But you think about it, it just makes it so hard to run a business. It makes it so hard to run or to pay for your day-to-day experiences. And worse yet, for that family from Eagle River, they went from Primera to MOTA because the premiums were too high. Now MOTA is leaving, and so they've got to go back to the insurer that was too high before. This family is just scrambling. What are they going to do? How are they going to be able to afford insurance in the future? And as the costs continue to rise, these small businesses are wondering, how long do we keep our doors open if these costs continue at these rates? In Anchorage, a couple with MOTA has been paying $2,500 a month with a $10,000 deductible, an increase of $1,000 a month over their premiums for last year. Now, they, again, are going to be switching to the only company in 2017 on the individual market. They're going to see yet another increase. A woman in Anchorage that we talked to has watched year after year as her rates increase from $500 a month to nearly $2,000 a month, and she's basically holding her breath for what the 2017 premium rates will hold. We don't know yet in Alaska because of the announcement from MOTA. We're not sure what the increase will be coming from the other insurer. But more and more, I'm hearing from folks who say that they feel it's just cheaper to simply not buy insurance, to pay the tax penalty, and then hope and pray that nobody in the family gets sick. But Mr. President, hoping to not get sick is not a health plan. And as more and more Alaskans are dropping out, costs for those that stay in go up, driving more to drop out, and you've got this death spiral within the system. The deeper we get into life under the ACA, the deeper Alaskans fall into a hole. The ACA has failed the people of our state. This one-size-fits-all approach rarely works for a state as diverse as Alaska, and it certainly hasn't worked in the realm of health insurance. But this is not the only place where we're seeing the law failing. There's more that needs to be done to make the Affordable Care Act work for rural parts of the country that have specialized needs, thanks to higher medical costs, lack of access, and now fewer insurance options. We in Congress need to take a serious look at the trends that we've seen and work on the solutions that will provide the flexibility that is needed for the states to make a difference when it comes to access to affordable care. Now, I have consistently supported full repeal of the ACA. I've voted to do so on several occasions now, but I've also recognized that it was going to be difficult, if not impossible, in this administration to do so. But I have supported steps that would reduce the burdens of the ACA and I think work to address some of the most harmful provisions in the law. One example is full repeal of the Cadillac Tax that I just mentioned. The Cadillac Tax will only worsen conditions in Alaska, with nearly 62% of customers that would be facing that tax if the Cadillac Tax were to be implemented. Again, I repeat, in our state, not only are health care costs so high, but our insurance costs are so high. And so whether you are in what would be considered a Cadillac plan because of the benefits, or it's just because you're paying so much for it, it is assumed that those benefits are good. 62% of the folks in Alaska would be impacted by this tax. And it's a prime example of the ACA hurting small rural states because so many of us have just more expensive health care due to the remoteness and due to our lower population size. And then those states are forced to take money away from things like our school districts, where they're trying to put the money into public education, into other services to pay for the costs. So our state suffers, our boroughs suffer, our schools suffer, and our Alaskan families suffer. So, you know, as we look to the end of this administration, I would hope, and looking to next year, I would hope we can seriously address the problems that the ACA has created for so many areas of our country. For rural states like Alaska, the approach to health care needs to focus on more than forcing people to just buy insurance, and unfortunately buy expensive insurance. We need to work to find solutions to these issues, whether it be through the creation of a nationwide insurance pool so that policies aren't limited to one state as they are currently. Right now, as I say, Alaska is not a very attractive market. We've got small numbers, we've got high costs. Who's going to come? How are we going to get a greater pool? We need to look more critically at how we improve the cost of transparency of medical procedures. We need to look critically at these special enrollment periods and see if people are finding loopholes that allow them to game the system. Expanding both health savings and flexible spending accounts will allow people to save what they think that they should and make the choices for themselves instead of the government forcing things on individuals. When we think about those areas that we can save money through not spending it in the first place, an ounce of prevention worth a pound of cure, we should be incentivizing people to live healthier lifestyles in order to prevent and bring down the incidence of chronic disease. Type 2 diabetes, largely preventable through lifestyle changes, costs an estimated $176 billion a year. Obesity-related illnesses cost an estimated $190 billion per year. And a recent study found that a 10% drop in smokers could save $63 billion in healthcare costs per year. It makes zero sense to be paying providers to treat these problems after they've arisen rather than trying to focus on the front end, paying for lifestyle changes, case management that would significantly reduce the costs of treating these diseases. So I've been working to find the solutions that will help support Alaska's rural needs, especially those related to access and workforce development. Because if we can improve the overall access to treatment and options to medical providers, we then take steps to reduce the costs of medical procedures. So I've supported the Family Healthcare Accessibility Act that will improve the care provided by community health centers by enabling them to utilize volunteer primary care providers. Community health centers, I think so many of us recognize the benefits and the crucial role that they serve in meeting the needs of rural and underserved communities, allowing patients to receive local treatment instead of being forced to travel far from home for treatment. So steps like these that help to improve access are just some of the ways that I think we should be rethinking our approach to healthcare in the broader sense as we seek to alleviate the burdens that have been imposed by the ACA. I have continued over several Congresses now to introduce the Medicare Patient Empowerment Act. This is legislation that would give patients the option to negotiate with their provider. So Medicare would pay the typical fee. The patient negotiates for the difference there. But we face a very unique situation in our state. Again, a one-size-fits-all prescription doesn't work for us. We have incredibly low reimbursement rates for Medicare in Alaska, and so you have very few providers that will accept Medicare. And so when you are newly Medicare eligible or you come into the state, it's tough to find anybody that will see you. So if there's some flexibility to negotiate prices, what we're trying to do with this bill is to cut through the red tape, allow Medicare beneficiaries to benefit from increased access, enable patients to continue to have the relationships that they have built with their physicians. We've got a very, very fast rising senior population in the state, and it's going to be increasingly important to make sure that they have the option to seek the care that they need. Mr. President, I do not support compulsory health insurance, but do believe that individuals with pre-existing conditions should receive care, and I continue as we discuss these important issues here in the Senate to work to address, again, these issues that have presented themselves with implementation of the ACA. So working to a place where we fully repeal and replace the ACA is where we need to be. There have been several Republican proposals that would not only replace this unworkable law, but replace it with consumer-based reforms. Senator Burr from North Carolina, Senator Hatch from Utah, Senator Cassidy from Louisiana, all been working on important measures that take steps to really get us to a place where what we're talking about is affordable health care, a reality that works for all Americans, whether you are in Alaska or whether you are in North Carolina. Obviously, much work in front of us, but again, it's important to recognize that the frustration that so many are feeling as they're seeing their costs increase, their access going nowhere, to let them know that we continue to work these very difficult issues. Alaskans deserve it, Americans deserve it. And with that, Mr. President, I yield the floor.